So now the lower limb, which consists of the femur and the patella, the fibula, the tibia, the tarsals, the metatarsals, and phalanges, like our toes. So let's get to the pictures and show you what you need to know. So here's the femur. This is the right femur. You can use your little key here. I think on some of the pictures I use, I actually show you this. Again, I'll go over that when you come back from break. The pictures you're going to use. And they're in the atlas and they're in the APR. So now the proximal femur, it has the head just like the humerus. I tell you what, it looks a lot like the humerus, even from my point of view. So make sure you know the difference between a femur and a humerus, because it really does get confusing. So now we have a new word called trochanter. So this big thing on the lateral side of the proximal femur is called the greater trochanter. It's over on the posterior too. Lesser trochanter is more medial. So you have this in between called inter, like inter means between, like in the front, you have an intertrochanteric line. In the back, you have an intertrochanteric crest. And I think that's pretty much it. I mean, it has a neck too, but I don't ask about the neck. There's one thing that's important here. I'm sorry. The fovea capitis, or just fovea, is a little dimple. It's like a little indentation on the femur head, and that's for a ligament. I don't know if you remember that from your iliofemoral ligaments or ligamentum teres that connects the femur to the acetabulum. So that's a point of attachment, a bone marking. So the shaft is always the long diaphysis of the long bone, and the femur is the longest bone anyway. So again, you're looking at pictures. So sometimes in the lab, you use a small femur and small humerus, and it gets confusing. So this could be an advantage here. Here's one thing that's important to know. Is a cute word called the linea aspera, and that's posterior. It's like a little elevation. Again, you have to feel it, but you can see it, and it's only posterior. So that's a point of attachment for the hamstring muscles. An insertion. Now, going down to the distal femur, let's take a look at the distal. This is right. Remember, this is anterior on this side. Oh, I'm sorry. Anterior is on your left, and posterior is on your right. So the distal, you have a surface for the patella. And as you remember, all long bones have that articular cartilage on the end. So the surface is for the patella in this case. Then you have lateral condyle and medial condyle. They're really big, especially in the back. You see the medial condyle and lateral. You know this is medial because the femur head is medial, right? Because the femur head is articulating with the midline acetabulum of the os coxa or ilium. And there's an intercondylar fossa. Inter is between, in between the condyles. I never really ask about epicondyles, but epicondyles are little bumps on top of the condyles. Epi means atop. So know the condyles of the femur, and you're gonna see this on the tibia as well. But this is, remember, this is distal femur. It's the same femur, it's just posterior and anterior. This is proximal femur, closer to the midline, up. So I guess the takeaways here are definitely the head, the fovea, the greater and lesser trochanter, the linea aspera, the medial and lateral condyle, the intercondylar fossa. Those are the main parts. And the patellar surface would make sense. So the patella is the patella. It just looks like a guitar pick, right? It's got a pointy bottom. This is the bottom, called the apex. And the top is the base. It sounds like it should go the other way around, but the heart does the same thing. So you can say it's heart-shaped. And the heart apex is at the bottom too. Right? So you picture the heart, right? On the side, little heart there. Right? There you go, beat, beat. And the articular surface behind, and that's going to articulate with that patellar surface of the femur, anterior to it. So the patella is basically just suspended in the quadricep tendon and the infrapatellar ligament. Infra means below. So no, that's a patella. There's no other bone. And I won't ask you carpals or tarsals. So That's the only bones that have that weird shape, So the tibia, here's the tibia and the fibula, which is nice. You put them together. And everything's right. If you notice, your book is using right. Now, be able to name the bone by itself. And the fibula is kind of boring. It's not really weight bearing. If you break it, or fracture it, you probably just have to wear like a soft cast, and it's not a big a deal as if you break your tibia. That's a whole different story. So remember this: in any position, the fibula is lateral, the tibia is medial. So the fibula is on the outside of the tibia. And look at the tibia, the proximal head. It's different than the radius, though, right? The radius is more of it looks like a nail head, which you're going to see in APR. Now, this is important. This is important on both sides. Now, remember, this is the anterior tibia and fibula. This is the posterior. So down here at the ankle, you could feel this bone, like that bone on the outside of your ankle. Sometimes you smash it into a wall or a door or something. Well, that's part of the fibula, and that's called the lateral malleolus. Sorry, I keep writing over this stuff. The lateral malleolus, malleolus. And then the tibia owns the medial malleolus. So this is why directional terms are important, and you're going to lose points if you don't say medial and lateral. And you probably have to know what bone too. So you have to know that the medial malleolus, which you could feel also in the ankle, smash that one too. The medial malleolus belongs to the tibia. The lateral malleolus belongs to the fibula. You can see it here, and even on the posterior. It's really tough to see anterior versus posterior tibia. In fact, I really can't see this part too much, but this anterior bump is called the tibial tuberosity. It's a little bump of muscle attachment. So that's where the infrapatellar ligament will attach. So it goes from the patella to the tibia. So remember, ligament attaches bone to bone. Patella, in this case, patella to tibia, where a tendon attaches a bone to muscle to bone. So like the quadriceps tendon is on top of the patella. So the tendon connects muscle to bone. So the quadriceps tendon connects the quadricep muscle to the patella, and that's a tendon. Just so you have those ideas. And all these are points of attachment for one or the other. You don't have to know if it's a tendon or muscle attachment. You just have to know it's a bone marking for attachment and name it. Really, you're just naming it. So again, be able to name those parts. Now the tibia has a medial and lateral condyle too. And in between, I'm sorry, I keep writing over this. You have like this little crisscross. It looks like this. It's like you have a condyle, then you have like this little bump on top, and then you have the other condyle. So on the tibia, you have the medial condyle. This is posterior, by the way. And this is and lateral condyle. And in the middle, you have these two little bumps. And this is called this makes sense now, between condylar. And now they throw a cute word in there called eminence. Eminence. That's two M's actually. So the intercondylar eminence are these two little bumps in the middle. So these are going to be points of attachment for what's called the anterior and posterior cruciate ligaments that connect the femur to the tibia. So this is kind of a cute name. Again, I always use the cute names on the practicals. So a lot of stuff here. Tibia is a little more complicated. Know the malleolus, that's the takeaway. Tibial tuberosity, intercondylar eminence. No, it's only one M. I was correct. I don't have my glasses on. And then medial lateral condyle of tibia. So first of all, on the questions, you have to know what bone it is. Unless I'm not asking you for that, but most of the time you have to know what bone it is, right? So that's important. Now the ankle bones and the foot and the toes. So this is looking at the top of the foot, which I think is a better view than, because you could see the talus more than the bottom of the foot. So I think one thing you should know, one tarsal you should know is the heel bone, is the calcaneus, And the one right on top of it is called the talus. So I don't know if that's on your list, but I think you should know the calcaneus at least, and talus. You don't have to know the rest of them. And again, these are anything below that line I just drew are ankle bones and heel bone. So that's easier. And then above that, you have and this is the right foot, you have the metatarsals. Metatarsal 1, 2, 3, 4, and 5 is the pinky toe. So the big toe is the medial, right? If you look at your big toe, it's closer to the midline. It's medial as opposed to the thumb and the arm or the hand. So these are metatarsals. So if I put an X here or whatever highlighted on the APR and I say, what is this bone? You're going to say, this is the second metatarsal. That's all you have to say. You don't have to say right foot. Now the toes are similar to the same number. Now there's 7 tarsals, by the way. There's 8 carpals, but there's 7 tarsals, one less. So the toes, the big toe only has 2 phalanges and the rest have 3. So they all have proximal phalange and they all have distal phalange. But digit number 1, the big toe, only has a distal and a proximal. And by the way, the big toe is called the hallux. Hallux. The thumb is called the pollex. So the pollex is the thumb. Just some anatomical terms for you. And the hallux is the big toe. So that's basically the takeaway there is same as basically same. First of all, you have to know it's a foot, not a wrist. I mean, and again, that's or an ankle, not a wrist. That's one of the things. Or a foot, not a hand. So that's the thing you have to first and foremost, do right away. And then when you go over to APR, you put all this to work. And keep reviewing, please. I know. I mean, I know you need a break. You definitely need a break. So take a break during your break, but you still have to review this, or else it's going to catch up to you.